If we can simplify that, where it says, here's the care that you delivered and you just got paid for it, it works. We've been experimenting with a no copay, no deductible model, just to say, is part of the ambiguity here and the problem of the cost of this ambiguity a function of too many parties involved, right? What happens, whether it's a $100 primary care visit to a $100,000 surgery, if you just take the member out of it?
And you're talking at Nomi Health right now.
Yes, we just said, listen, we're going to go like rip this thing apart. We're going to have it all data driven, all digital straight payments, no copays, no deductibles. And like, we're going to price in the risk. We're going to see what happens. Let's kind of go do this. And three things happened. One, the contracted rate we found with the providers when no ambiguity of collections for the services that I just delivered. So we call that the real cost of healthcare, right? The real price was roughly 20 to 30% lower than a BUCA traditional contracted rate, which for us is pricing in the risk of non-payment. That's the difference. If you have zero risk of non-payment, then it's this price. If you have to price in the risk of non-payment, then it's that plus. Simple. The second factor was what happens to utilization patterns? Because the myth is you need copays and deductibles to mitigate utilization. Does that make sense? Like if you don't have copays and deductibles, healthcare is going to go crazy and whatever. Now, this isn't Medicare. These are working age families who have other things to do in their life. There's like a natural limiter to how much healthcare they're going to be able to go and get because it's life. So it turns out total number of claims, like just claim volume, utilization went up like 7-8% in claim volume. But mix, that 7-8% increase in claim volume was a bit more mental health, more physical therapy, more primary care, bit more specialty visits. All the things that people put off because they were underneath their deductible. The other mix, though, is what breaks the self-insured plan isn't primary care. It's NICU babies, cancers, accidents, and there weren't more of those things. There weren't more NICU babies. In fact, we're going to find out if there's less, but there wasn't more of those things. And then the third dynamic was, in our own personal lives, what we've done from a behavioral economics standpoint, when you hit your deductible, there is such a fascinating acceleration of utilization, right? Well, what happens if behaviorally you don't have to worry about that now? And we've been watching it. And it didn't take 2-3 years to figure this out. It took one. It literally just smoothed. It just smoothed out. And so in this pilot area, you're now seeing a 38% decrease in healthcare costs.
Wow.
And, we need to see the whole year prove out. But even if that cut in half because people went and got that care and whatever, 20% healthcare cost decrease.